testimony. Dr. Goldstein, in your testimony you mentioned, and I quote, the consequences to the American public of our delay in addressing the important issue of climate change. And you stated, but the threshold for action should not be the overwhelming evidence that's already in place. The threshold should be sufficient evidence to take out an insurance policy to protect the American public, a threshold level that we passed a long time ago. And you go on to discuss the 3 levels of prevention: primary, to cut back on the causes of greenhouse gas emissions; secondary, to prepare to mitigate the consequences when they occur. And then you added that we want to avoid the tertiary prevention, such as paying billions of dollars to help clean up after extreme storms. So we've heard a lot about cost-benefit analysis in this hearing. So will you please discuss and expand on why it's important to consider the costs of all 3 levels of prevention you mentioned in your testimony when weighing the costs and benefits of environmental regulation?
Thank you. What I've said about an insurance policy is basically what Mayor Bloomberg said after Hurricane Sandy, and what the insurance industry has been saying for quite some time. The insurance industry is now requiring people to consider, as they give out insurance, to consider potential issues related to greenhouse gas. There's no question that it's occurring, and there's no question that we need to look at it. Primary prevention is always the best. We've lots of economic figures. I've always been amused by the fact that they usually come out with a 16-to-1 ratio, which is equivalent to an ounce of prevention is worth a pound of cure. We need to be able to prevent, and we need to be able to prevent by basically cutting down on greenhouse gas emissions in a way that's cost effective. We can do it. We should be doing it, but we need to really push hard to make it happen, and Congress needs to be involved. Secondly, we need to improve the resilience of our communities. We need to be able to be responsive to these issues. I chair a piece of the BP settlement, which at the request of the BP lawyers and the plaintiffs' lawyers, that's providing, it's the Gulf Region Health Outreach Program, which is aimed at improving resilience on the assumption that there's going to be another major disaster in there, and the community and the physicians and everyone else should know better to be able to deal with this. These are the kind of efforts that we need, but we shouldn't have to wait for a major disaster to cause litigation to fund it. We need to be able to build resilience now so that people can respond.
Thank you very much. Mr. Trzupek and Mrs. White, you both have been on the regulatory side of environmental issues for a long time, and you both suggest in your testimony that the regulations that EPA is currently pursuing are onerous, not shown to yield many benefits. And both of you assert in one form or another that the EPA may be exaggerating some of the health benefits and basically incorrectly evaluating the value of statistical life and health benefits. So I wonder if you could consider the high cost of health care in this country and the impact that that has on our deficit. Won't the cost of reducing air and water pollution yield savings to the healthcare sector and save this country money?
I'd be happy to initially respond. If you conclude, as I do, after an attempt to really scour how EPA builds their cost-benefit analyses, if you believe that they are imputing health risks at levels so low, way below the national ambient air quality standards, that there are probably not any measurable health benefits, then the costs is not justified. And I give you an example from the Mercury rule, the Utility MACT, as it's often known. EPA has acknowledged that it's probably the most expensive rule, single rule that they've adopted to date. Something like, I believe, at adoption, at proposal, they said it would be $11 billion in compliance costs, and at adoption, I think they took that down to 10.6 or something like that. When you look in the Federal Register, not interpretation, but you look at the numbers, where they get very technical, EPA acknowledges that 0.004% of what they calculated benefit come from reduction of mercury. And the others, all the other, which is what, 99 plus, come from coincidental benefits from reducing fine particulate matter. Then I don't see how what EPA calls the most expensive rule to date, which the National Electric Reliability Commission and others have said has most risk of electric reliability across the country because of the rule may lead to a rapid closure of a significant part of the older coal-fired power plants. Then to me, the costs far outweigh the benefits.
And I'm afraid my time has expired, so if I could ask Mr. Trzupek to respond perhaps in writing. We had a lot of discussion about the role of industry in developing innovative technologies to reduce emissions. And I know, Ms. White, in your testimony, you talked about prosperity and the importance of prosperity and how Los Angeles did a better job than China. I just want to suggest that perhaps because we do have strong environmental laws and regulations that motivate that innovation. I wanted to ask Dr. Goldstein to follow up a little bit about lead, because Ms. White said a couple of times that lead has been virtually eliminated, and I wanted you to discuss the studies about that, and also, isn't there still work to be done?
Well, yeah, virtually eliminated is simply too strong a term, I think, for what happens still in communities that have a lot of lead burden in their homes. Again, as a teacher, when I teach about environmental justice, I usually make the point that if something that was affecting the IQ of America's children was built into, say, suburban housing post-war, say the Formica tops to tables, we would have gotten all that out by now. We haven't done that with the lead yet, and we still have homes with lots of leads. We still have kids who are affected. We have, I put in my testimony, HUD's cost-benefit analysis of the tremendous value of taking the lead out of childhood homes. We simply haven't done it yet. So to say it's virtually eliminated, that's true for me, but it's not true for important segments of our population.
And just to follow up, how much certainty was there in the science about reducing lead in the 70s when the studies began?
Well, in the 70s and the 80s, people have forgotten that the Reagan administration took the last lead out. It was based on a cost-benefit analysis that OMB bought, and that it was costing more to have lead in than before. And that's at a time that CDC did not have as stringent a requirement as it has now based upon the new data. So that the lead issue, we were late on that, as we've been late on a lot of these issues that we recognize now were causing significant adverse effects, as I think, as I've testified, that we're late on the global climate issues as well.
Thank you. And I yield back.